Mandible from medial view. Visible on the medial view of the mandible are the body of the mandible, the alveolar process of the mandible, and the ramus. In addition, near the midline of the mandible are the genial tubercles, or mental spines, a cluster of small projections that serve as a muscle attachment area. At the lateral edge of each mandibular alveolar process is a rounded, roughened area, the retromolar triangle, just posterior to the most distal molar of the mandibular arch of the detention. The retromolar triangle is a bony landmark that, when covered with soft tissue, is the retromolar pad. Along each medial surface of the body of the mandible is the internal oblique ridge, or mylohyoid line, that extends posteriorly and superiorly, becoming more prominent as it ascends each body. The mylohyoid line is the point of attachment of the mylohyoid muscle that forms the floor of the mouth. A shallow depression, the sublingual fossa, which contains the sublingual salivary gland, is located superior to the anterior part of the mylohyoid line. Inferior to the posterior part of the mylohyoid line and inferior to the mandibular posterior teeth is the deeper depression, the submandibular fossa, which contains the submandibular salivary gland. On the medial surface of the ramus is the mandibular foramen, which is the opening of the mandibular canal. The mandibular foramen is 3/4 the distance from the coronoid notch to the posterior border of the ramus. Overhanging the mandibular foramen is a bony spine, the lingula, which serves as an attachment for the spinomandibular ligament associated with the temporomandibular joint. A small groove, the mylohyoid groove, passes anteriorly to and inferiorly from the mandibular foramen. The articulating surface of the condyle can also be seen in this medial view. This is where the mandible articulates with the temporal bone at the temporomandibular joint.